And it would be, we usually have this at 9 p.m. West African time. So for everyone in CST, EST, GMT, just adjust 9 p.m. West African time, last Saturday of the month. If for any reason this this meeting would maybe be rescheduled with the timing because we have other programs, with PwC, we'll definitely communicate that. But today, like I said, we have Dr. Temitope Okoro, and I'll be handing over to her very shortly. Please, a round of applause in the chat room for Dr. Temitope Okoro. Okay. Dr. Temitope, I'm handing over to you now. Dr. Temitope, are you there?
All right.
Oh, I forgot to add that she's married with 2 children. So she speaks as a mom and as a, professional that works with children. So you're welcome once again.
Thank you very much. All right. Good evening. Thank you all for joining today's health talk. I also want to use this opportunity to also thank PwC for this platform to give this health talk to our mothers, aunties, big aunties, big mommies, our grandmothers too. Thank you very much. So this topic we're treating this
Sorry, Dr. Timothy, you're muted. We can't hear you.
network. All right, so we're about a very, very important topic: home management of diarrhea in children. And the reason why this topic might look simple, like maybe it's diarrhea. What I'm really saying, but it's a very as simple as the name might look like. Diarrhea was there. It's really it can cause severe complications, especially in children, and that's why we're looking at children. For an adult can just say, I just have diarrhea, but be fine. But I mean, in children, one.
Okay, I think we lost Dr. Temitope. Dr. Temitope, are you still there?
Did you call me?
I mean,
Yes, we lost you for a bit. We couldn't hear you for a bit.
there are three subjects in this topic. The first one is diarrhea. The second one is we're looking at the group of people that affects children. And the third subject is home management, what we can do at home when our children have diarrhea. Okay, this is my the slide is not moving. Okay, so this is my outline. Talk about introduction, causes, clinical features, how they present, management, how do we prevent, and look at the question and answer section. I don't know, do we have anybody who has any child, biological, your grandchild, your niece that's experienced diarrhea and then it wasn't compatible, and you can share with us what did you do about it? Did the child end up going to the hospital? What was done? Or if not, if the child was at home, what did you do at home for the child that to stop the diarrhea? if we have anybody who can just unmute our experience with us before we go to the discussion proper. Anyone, please?
Also, Doctor,
Okay.
yeah, I don't know. Is there a way you can adjust the network or something?
You said I can't hear you well.
I mean, your network is going in and out. If there's a way you can adjust your network or maybe change of
Okay.
network or position or something.
I'm actually using, I used one earlier that wasn't good. I switched to another one that is also misbehaving. I speak peace to this network, and I'm using MTN network, and MTN network is good, yeah.
Wow.
Mm,
Speak peace.
just I really don't like the interruptions. Mm. Okay. Okay, so do we have anyone who wants to share his experience that child had with diarrhea and how it was managed? Anyone?
Keep quiet, please. Sorry, guys. Hello.
You said?
Okay, so I was just gonna. My name is
Okay, we
Motura. I
can
was
hear
going
you.
to share. Yes, I'm going to share my experience. I've had that experience. I think with my even more recently with my daughter because she's 6, and I remember when she started preschool. There was a particular day I went to pick her from school and her teachers told me that she had been complaining of feeling nauseated. So on our way to pick her brother, we were actually on our way to, I can't remember, Sha, we were still out of the house. She really, really threw up. She vomited and it was a lot. And then by the time we got home, we settled that down and everything. And then she said she wanted to poo. Then she went to the bathroom, and that was it. This was like 6 p.m. And that was what we managed all through the night till the following day. So she would vomit, she would poo. She was vomiting and pooing and vomiting and pooing. But she wasn't running any temperature. So I called the pharmacist and he just told me to check. And he said, if there's no temperature, that means there's no infection or something like that, that we should just keep her hydrated, because it was at night.
Okay.
And usually here,
Mm-hmm.
even in, I think, yeah, because even here, so that's how they treat it here. If the child is not running temperature, they will just tell you to keep the child hydrated until that whatever is causing the irritation she would pass it out or something, either by throwing it up or by pooing, that it will eventually stop. But as a mom, you can't, I mean, you can't keep watching your child keep throwing up and stooling, and the child is just getting weaker. You can tell. You can't even give the child water. If you give the child a drop of water, in 2 minutes she's throwing it back up and everything. So I think eventually we had to drive to the following day. I had to call the pharmacist again. So he asked me to come, and then he gave there's this, I can't remember. I think it's like an ORS that already been prepared. Orange. So here they have it already
Okay.
prepared and different flavors. So he gave that.
Yeah.
He gave like a what was that thing called? Is it gravel or something? I think it's to help with nausea. Then he also gave that pink thing. What's it called? Pepto-Bismol. He gave Pepto-Bismol as well.
Okay.
And then he gave her one tablet. I don't know. He just put it in her mouth under her tongue and told her to leave it there. So Anyway, by the time we got home, I noticed that the vomiting has stopped, and he told me to give her the Pepto-Bismol, just one tablet, and that I will notice that next time she was told it should be black or something, I shouldn't be worried, and that was how.
Okay.
And that was how it stopped. And then, after I don't know what that tablet is, one tiny white tablet, you just put it under her tongue. And then we came home. So by the time we got home, she started asking for yam and egg. And and I think that was it. Maybe like two more stools. And yes, the stools came out black, like I said, and that was how it was resolved. But I remember throughout the night while she was throwing up, we just tried to keep her. I just kept my eye, kept an eye on her.
Oh,
And of
yes,
course, as a
good.
mother,
Thank
you
you
can't
very much,
sleep.
Doctor.
Yeah, you just keep watching, and it's really scary.
Yeah, it is. It is. It is. It is. Thank you very much. So let me go to the point. There's something we're trying to discuss in this presentation for tonight. So what is diarrhea? I know some of us know what diarrhea is. Oh, passing watery stool. Once the stool is watery, stool that was normally formed. Normally our stools are expected to be formed. But once we start seeing a change in this consistency, oh, the stool is loose, is watery, and we're thinking of diarrhea. So diarrhea is actually simply the passage of loose or watery stool, usually at least 3 times in a 4-hour period. But because in this definition, there are 2 things. One, the frequency, which we said at least 3 times in 24-hour period. And secondly is the consistency, that is whether it is loose or watery. However, in children, we usually consider consistency. Consistency is the most important thing to us rather than the frequency. In other words, what I'm trying to say is that a child might have an episode of diarrhea, an episode of watery stool. And if the child presents maybe to the hospital, or maybe you are the friend of the caregiver, and so this child does poo and the poo was watery, you won't say, Shebi is just once, and let's wait when it is number 3. No. We won't wait till that. One child has had an episode of watery stool, we want to take action immediately, so that we won't wait till we still want, and when it's theory. No, we don't do that for children. So that thing to us is the consistency of the stool, rather than the number of times the child has passed the watery stool. So frequent passage of form stool is not there. So when somebody goes to the toilet 5 times and is passing form stool, normal stool, that is not diarrhea. Our definition earlier is passage of loose or watery stool, so not formed stool. So once child is having frequent passage of form stool, it is not diarrhea. And babies that are usually breastfed, they often pass like a pasty stool, loose pasty stool, and that is not also diarrhea in those sets of babies. Now, why are we discussing about diarrhea? Diarrhea disease is the 3rd leading cause of death in children under 5 years of age, and that's why this topic is so important. And as simple as the word may be, diarrhea is actually can be preventable and treatable. Now, where are we particular about diarrhea? The reason why diarrhea can cause mortality in children is not even because of the diarrhea itself, but rather than the complication of dehydration that it can cause. Diarrhea can cause dehydration. Dehydration from there, if a child is dehydrated and is not well managed, is not well treated, can cause reduced urinary output. From there, it can cause acute kidney injury. From there, it can cause septic shock. From there, it can cause death. So it's always sometimes annoying, let me use that word annoying, when a patient presents to the emergency and I'm like, oh, madam, what's the issue? Oh, the child is passing, it's passing watery stool. Oh, since when? Started 2 days ago, 3 days ago. Okay, what did you do for the child? What did you use? I didn't do anything. Like, what? You didn't do anything for the child that has been passing watery stool? One, you didn't even present. Child that's passing watery stool 3 days ago. You didn't even present immediately to the hospital. You were looking at the child, and now the child now present to the hospital. No, the child is septic. There's fever. Child is not making urine, the child is in shock, everybody's running up and down to resuscitate the child, go and get this, go and get cannula, go and borrow this, go and this, So you'll be like, shebi it's just diarrhea, like it's just diarrhea. So what's the big deal about it? There's really, really a big deal about diarrhea. So during diarrhea, there's an increased loss of water and electrolytes in the liquid stool. So once the child is passing watery stool, the child loses water and also loses electrolyte like sodium, potassium in the stool, which is not good. And when this loss of water and electrolyte, when they are not replaced, then dehydration sets in. Occurs when these losses are not replaced and there's deficit of water and electrolyte, which is what we actually try to prevent in patients, in children that have diarrhea. You see that dehydration, Ganga, that is what we're trying to prevent. We don't want them to get dehydrated. It's not a crime to have diarrhea, but it's a crime when a child has diarrhea and is dehydrated. We don't want our children to be dehydrated when they're having diarrhea. So infants are at higher risks of dehydration from diarrhea because they have higher body water content. That is why notice a baby or an infant that has diarrhea, and within some hours, you notice that this child that I was carrying that was maybe choppy or plumpy when you carry the child, look like the child is light. And that's because most of our infants, babies generally, their bodies, their body is actually made of, they have higher body water content. And don't forget, I said earlier that in diarrhea, there's passage of water and electrolytes. So when they are losing this water, losing this electrolyte, they are at higher risks of having dehydration, unlike we adults. And dehydration can be mild, it can be moderate, it can be mild, it can be moderate, it can be severe. Okay. Now we can see this child. I'm sure if I ask us what's the level of dehydration this child has, you don't even you just go straight to the point and say severe, because you can see how the child is weak. He's even on intranasal oxygen. We can see the cannula, the intravenous line access that are given to the child. This child I don't even know whether this child is even conscious in the first place. That's to tell you how severe, how sinister diarrhea can be if it is not well managed. Yes. Okay, so next slide. Okay, so now what are the causes of diarrhea? It could be, most of the time, it could be infectious. And usually infectious, when I say infectious, it could be of bacterial origin, viral origin. But in children, it's usually viral. And the commonest organism that has been found out to cause, the commonest causative organism for diarrhea in children is rotavirus. I'm sure rotavirus we ring a bell to we mothers that are on this platform. We know that rotavirus is part of the immunization that our children are being given in the National Program of Immunization Schedule in Nigeria. And that is simply because, and why this is important is because of, like I said earlier, the diarrhea causes part of morbidity and mortality of children under 5 years of age. And so that's why it was introduced in the national, initially before rotavirus, people pay for it. Like, it was not part of the immunization schedule. It was part of like all this special immunization that if you want to get it, you have to pay out of your pocket to get it. That's rotavirus. Immunization like rotavirus, pneumococcal, they were under special vaccines that you have to pay out of your pocket to go and get it at the pharmacies and administer to your child. But of recent, it was introduced to the National Program of Immunization Schedule, so it's free. So when babies are going for their normal immunization schedule, they get these doses of rotavirus in their in the immunization schedule. Contaminated water, when the child drinks water that is contaminated, or foods that is not well properly, that was not properly well taken care of, was not the preparation was not good, the storage itself too was not good. Those are source of infection, and the child could come down with diarrhea. For some children, lack of exclusive breastfeeding. In this area, what we mean is that child babies that are usually bottle fed, and we hear some mothers say, oh, they're taking a baby milk formula. Okay, that's fine, no problem. Why? Okay, maybe they're not lactating well. Okay, it's understandable. At least the child won't have to go hungry. But you now ask some of those mothers, how many feeding bottles do you have? And some will tell you they have one. So you can imagine a baby that is being fed now, and then maybe in 30 minutes, and maybe is hungry. So are you saying within 30 minutes you go and wash that? So is that same one bottle? Definitely now. They might not wash that bottle very well, the feeding bottle very well, before they prepare another meal for the child and give the child that same bottle again. So that's why babies that are formula fed, and if the feeding bottles are not well sterilized, and that's why usually we see pediatricians, they always frown against feeding bottles, and not because, and it's because of the sterilization process. You see that teat, that's where the teat, like TEAT, where the baby suckle on, if it is not properly cleaned well, there are sources, bacterial infection, germs can hide in that place. And when the child is taking in formula during feeding, can also take in the microorganisms too, and could also be a source of infection, and child can come down with diarrhea. And that's why we usually advise that parents mother uses cup and spoon. That one is easy to wash. There's nothing hiding anywhere. You are taking your sponge and you're washing it, and it's easy to wash. So babies that they are not exclusively breast may present with diarrhea. And the reason why, because the immune system is low, the immune system is not strong, they can't fight infection, HIV, AIDS. Child can't fight infection. So once a child is immunocompromised, they can come down with diarrhea. Now, how do you assess a child that the first thing you want to look at is this child alert? Or you want to look at the physical well-being of the child? Like the picture we earlier saw, you can see that child is lethargic. I don't know, I'm sure that child may be unconscious, may be in coma. So you want to look at the physical appearance of the child first. Is the child alert? Is the child restless, irritable? Is the child lethargic or unconscious? Then look at the eyes, the eye socket. Is it normal or is it sunken? Sunken, like, does it look like the eyeball has gone inside? That's I can define sucking. Does it look like the eyeball has gone inside? Then when you give this child water, or you give this child ORS, we'll talk about ORS, to drink, does the child take it normally or refuses it? Or does the child take it eagerly, like, or the child cannot even drink at all in the first place because the child is lethargic or in coma? Then does this child's stool, does it contain blood? Because it's important for us to know that there's a difference between diarrhea and dysentery. In dysentery, yes, there's part of watery stool, but there is blood stain in it. So the diarrhea we're talking about here is just plain diarrhea, just like plain passage of loose or watery stool. There is no blood inside. When you see blood inside a stool, watery stool, that's a different entity entirely, and such child cannot be managed at home. The child has to be taken to the hospital. So that's not the case we're talking about. We're just talking about diarrhea, just plain diarrhea, just passage of loose, watery stool without no blood in it. Is the child malnourished? Does the child have fever? For fever, any temperature reading greater than 37.5 degrees Celsius. Our normal temperature is 36.5 degrees Celsius to 37.5. So any reading above that, we're talking about fever. So those are questions you want to ask yourself, and these are clinical physique you want to look at about the child. Is the child alert? Is this child restless? Is the child irritable, cranky? Is the child lethargic? Is the child unconscious? How are the eyes? Is it normal or sunken? Then also this kind of children, when they are crying, you look out for tears. Is this child, when the child cries, is tears coming out? That's just to assess the level of hydration. Dehydration, this child is for a child normal now. If a child cries and cries, you expect tears. But when the child is crying and crying and you're not seeing tears, you know that the dehydration level of this child is either between moderate or severe. Then when you give the child ORS, or the child drink it, is he ready to drink it? Is he eager to drink it? Or the child cannot even drink at all because the child is lethargic or either in coma. Then you want to ask this child's stool, is this watery stool, any blood in it? Is the child running temperature? Then by looking at the child, is this child malnourished? Those are questions you want to ask yourself in assessing a child that has diarrhea. All right. So what is the treatment? What are the aims of treating a child that has diarrhea. One, prevent dehydration. Like I said earlier, having diarrhea, a child having diarrhea is not a crime. It's not a death sentence. But the important thing is, if this child that has diarrhea, we want to prevent this child from being dehydrated. So first aim of treatment is to prevent dehydration. The second is to treat dehydration if it is present. And this first aim, which is prevent dehydration, this is where the home management comes in. This is where we mothers, aunties, grandma, this is where our role or our duty comes in first in preventing this child from having dehydration. Secondly, to treat dehydration if it's present, and that one might require, in some severe cases, might require the child to be taken to the hospital for that to be attended to by the physician. They want to prevent nutritional damage, and you also want to reduce the duration and the severity of diarrhea and the occurrence of future episodes by giving supplemental zinc. So now, the home therapy to prevent dehydration and malnutrition. The first rule of thumb is to give the child more fluids than usual to prevent dehydration. If you remember when Motrayo was sharing with us our experience, they said the pharmacist told her that she should give the child fluid. For that, we said earlier that dehydration in diarrhea, they are losing fluid and electrolytes. So you want to replace this fluid that they are losing. As they're losing the fluid, you want to be replacing it so that the child does not come down dehydrated. So you want to give the child fluid. Now, what are the fluid you can give? When I say fluid, I'm not saying you should not give the child Coke or Fanta or give tea. So the fluid we're talking about here is, first of all, is you can give the child plain water. As simple as plain water, you can give the child plain water. In that plain water, you're replacing just the fluid. But don't forget, I said earlier in diarrhea, we replace diarrhea, they lose both fluid and electrolytes. And that is where ORS, oral rehydration solution, comes into place. Oral rehydration solution contains electrolytes that can be used to replace the electrolyte that is being lost during diarrhea. You can use salted drinks like salted, I'm sure we've heard of salted rice water. Yes, salted rice water they can be given. Salt sugar solution can also be given. Salt sugar solution was actually what they've been using, what our parents or healthcare were using before ORS was brought into limelight. Is this salt sugar solution? Unsweetened drinks, you don't give soft drink. That's not the time you give Ribena or give glucose boost. That's not the time you will give it. Don't give sweetened food drinks. You don't give sweetened tea. That's not the time you give children those sugary things. Not the time. When they're having diarrhea is not the time. Just suspend all those ones for now. Now for the short for the ORS, this is how ORS, this is how a sachet of ORS, this is how it looks like. Can see WHO, that's World Health Organization recommended ORS. This is how ORS looks like. I'm sorry, the picture is not clear enough. It has the components are there, the constitution are there. We have potassium, we have sodium, we have chloride, we have glucose. Glucose itself is also there in this ORS. Now, how do we prepare ORS? And this is where I want us to pay attention to, because we've seen parents that tell you, oh, we'll be giving the child ORS now. We'll be giving child ORS, and you look at the child is severely dehydrated. No, you'll not be forced to ask, madam, okay, I'm not arguing to that you'll not be giving this child ORS. Please, how did you prepare this ORS? Then you now start hearing different kind of preparation, which is wrong. So in that there and there, we now have to start correcting them, which is wrong. So now this is how you prepare ORS. One sachet of ORS, you give one sachet of ORS is mixed with 1 liter of water. One sachet of ORS is mixed with 1 liter of water. What do I mean? the 1 liter of water, you can get this big Eva water. You know, this big Eva water is 1.5 liters. The big Eva water is 1.5 liters. So where the there's a wrapper around the bottle of that Eva water where they wrote Eva water here. The first mark or the beginning of that wrapper, the beginning of that wrapper, definitely the water in the Eva water is above, is more higher than that wrapper line. So you have to decant the water. Either you decant it or you drink the water to the level of that first line of the wrapper. That is the wrapper that is tied around, the wrapper that is around the Eva water, where they wrote Eva, that nylon. You see that first line of that wrapper? That is where you decant the water to reach, and that will give you 1 liter. The reason why I'm saying this is that most of the bottled waters we have outside, they are 750 mils. That's 0.75 liters. 750 mils or 0.75 liters is not the same thing as 1 liter. Because I've seen the day I wanted to prepare ORS for my child. I went to the pharmacy to buy ORS. I said, oh, do we have Eva water? He said, no, but I can use this for money. This is 750. He said, you can use money, Oga. Sir, is 1 sachet of ORS to 1 liter of water. And the reason I have to tell him is that definitely you see mothers going to the pharmacies to go and buy ORS and to also buy bottled water alongside. If I don't correct him, or if I don't correct him so that the mistake will not go on being repeated. So I have to tell him right there that, sir, it is 1 liter of water to 1 sachet of ORS. Because if we prepare 750 mils to 1 sachet of ORS, some others will not tell me, I didn't pour everything. Because they know it's 750 mils, they will not tell you they didn't pour everything. So I'm like, so the one that you did not pour, is it that if you put it in 150 mils, it will add to it? All those calculations you can't do, because this ORS is powder. It's powder form, it's not tablets. So you can't do those calculations of I remove small and I put small. I did not put everything. Like, the instruction is there. 1 sachet of ORS to 1 liter of water. And I've explained how you do that. Then you mix it together. You mix it because it's powder, so you have to mix it so that it dissolves well, and you give it to the child. Another one is the salt sugar. Okay, how do you give ORS? You give to infants and young children. You can use a clean cup or spoon. And for babies, our infants or neonates, you can give them you can use a dropper. That dropper that comes along with, I'm sure we know dropper now, that comes along with some medication like paracetamol. You can use the dropper or syringe without the needle. You can be using it to put small quantity into the mouth of the baby. For the salt sugar solution, how do you prepare it? We need no salt sugar, like I said, salt and sugar. So for the salt, you give like half teaspoon of salt. You put it in a bowl. Then 6 teaspoons of sugar. I'm sorry, I didn't include it here. 6 teaspoons of sugar. So half teaspoon of salt, 6 teaspoons of sugar. You mix it together with 1 liter of water. That is what you use to prepare your salt sugar solution in case you don't have ORS. And so that's why it's important as mothers for us to have ORS in our cupboard. There's some drugs, there's some medications that you should have as mother that you can use to give first aid treatment before you get to the hospital, if need be. ORS is one of them, because you don't know if in events that the diarrhea starts in the night, in the middle of the night, where do you want to run to? So at least before the day break, you're already giving ORS to the child before you cannot take the child to the hospital if need be. Let me go fast because our time is fast spent. Okay, so how much fluid? How do you know how much fluid you give to the child? For children that are under 2 years of age, you give about 50 to 100 mils of fluid in a 24-hour period. And children that are between 2 to 2 years, you give them about 100 to 200 mils of fluid ORS in a 24-hour period. Rule 2, supplemental zinc. Why do we give zinc to children? We give zinc to the child that has diarrhea to reduce the duration and the severity of the diarrhea, to also reduce the risks of dehydration, and the severity of diarrhea. That is why we give supplemental zinc. Now, how do we give the zinc? The zinc comes in tablets. It comes so for children that are 6 months of age, you give them 1 tablet, which is 20 milligrams. While children that are less than 6 months of age, you give them 10 milligrams. That is half of that tablet, 10 milligrams. You give them for a period of 10 to 14 days when they're having this episode of diarrhea. So ORS alongside with zinc, you give children with diarrhea. When that's diarrhea, is not the time that you stop feeding. No. You have to continue to feed the child in order to prevent malnutrition. So you continue feeding the child. Yes, the child may not be eating as he or she usually do, but the little the child is taking, give it, and you might have to, maybe for instance, if this is a child that eats maybe like 4 times in a day, during that period the child has diarrhea, you might have to increase the frequency to maybe 8 times in a day because the child is taking little quantity. So yes, little quantity, but increase the number of times the child is eating during that period. Rule 4, take the child to the hospital if there are signs of dehydration or other problems. Like I said earlier, the aim of this health talk is to teach us how to manage diarrhea at home, how to prevent dehydration at home for a child that has diarrhea. But there are instances that have diarrhea. One, if the child starts to pass many watery stools, was passing 2 episodes of stool in a day, and as I said, another 5, 6, 7, you have to take that child. That's why the father are giving ORS, you have to take that child to the hospital. If the child is vomiting, a child that is vomiting, give the ORS, do not take your ORS. And those times you have to take them to the hospital. Once the child becomes very thirsty, it shows that the level of dehydration that child has is severe. So you have to take that child to the hospital. If the child is not eating, you have to take the child to the hospital. Once a child has fever, once fever develops, you have to take the child to the hospital because that could be the fever that the child is having could be a telltale sign to something much more sinister. Probably the child is now a superimposed bacterial infection. Don't forget I said diarrhea, the most common cause, the most common etiology, infectious etiology is viral. Viral, rotavirus, viruses, what they usually need most times are supportive treatments, and they will go. So when a child does have diarrhea, and the child has diarrhea and also has fever, it could be pointing to a bacterial source of a bacterial cause of it, and that situation you have to take the child to the hospital so that the child can be evaluated and the choice of antibiotics can be given to the child to treat. And if the child does not get better in 3 days, you have to take the child to the hospital. Now, there are some don'ts that we have to take notes. Don't forget, our topic is home management of diarrhea in children. Children, that's our emphasis, children. For children, we don't give drugs to stop diarrhea. So that's not when I'll be hearing give most of the common drugs mothers usually talk about. Diastop, Lomotil. Those are the common drugs they usually give used for anti-diarrhea agents. We don't give such to children. Adults, yes, people can be using your anti-diarrhea agent, loperamide, you can be using it. But for children, we don't give medications to stop the diarrhea. And the reason why we don't is that these anti-diarrhea drugs, there's no practical benefit for children with for them using this anti-diarrhea drug. And this anti-diarrhea, they do not prevent dehydration. None of them will say that having diarrhea is not a crime. But the most important thing while the child is having diarrhea is to prevent dehydration. So if we give this child that's having diarrhea anti-diarrhea drug and the child is dehydrated, the dehydration will even kill the child much more faster than the diarrhea that you've even given the anti-diarrhea agents for. So we're not after the anti-diarrhea drug. Anti-diarrhea drug will not prevent dehydration for this child. It will not improve the nutritional status of the child, which is the main objective of our treatment. So we don't give children anti-diarrhea drug. Secondly, we don't give antibiotics routinely for diarrhea. People will say, oh, child has diarrhea, go and give flagy. Because I know that's what we adults like. Even the flagy, once the adults start taking the flagy, once the diarrhea stop, they stop. They're forgetting that flagy is an antibiotic. We just abuse antibiotic anyhow as they like. For children, we don't give antibiotics. But there are cases where we give antibiotics. And that's why I mentioned, I know some of the points we made earlier of reasons why you have to take them to the hospital. We only give antibiotics prescribed by a doctor and could be for many reasons. For instance, if the diarrhea is bloody, if it's bloody diarrhea, that means they're taking of dysentery. Or if the child is passing rice water stool that you're suspecting cholera, you want to give antibacterial, you want to give antibiotics to the child. If the child is having fever, in that scenario, you want to give the child antibiotic for the diarrhea. But routinely, we don't give antibiotics for diarrhea. So a child start passing water stool, the first thing that should come to your mind is not antibiotic. The first thing I need you to be thinking of is to give this child ORS and to give the child zinc. And if the child is not getting better or develops fever or is not tolerating the ORS, is vomiting, the child is too weak to drink the ORS, the child is not tolerating well, child is not making adequate urine, the child is lethargic, unconscious, in coma, those are when you take the child to the hospital. Prevention, how do you prevent diarrhea? Access to safe drinking water, improve sanitation, hand washing with soap when we're preparing their meals, exclusive breastfeeding for the first 6 months of life. The advantage of exclusive breastfeeding again is that there's transfer of antibodies, maternal antibodies to the child, which will help to boost the immune system of the child and help to fight infection. Avoid the use of feeding bottles. Avoid the use of feeding bottles. Preferably using a cup and spoon is better, so that because the risk of germs staying there in the feeding bottle, in the teeth of is high. So we usually we advocate for cup and spoon for babies to be using. Then limit multiple caregivers. This scenario, what I mean by this is that, for instance, if a mother that just gave birth, you are the one taking care of the child, maybe you and your mother-in-law or you and your mother taking care of the child, just limit it to just the two of you. Not that auntie one day will come, you tell auntie one day to go and wash child's feeding bottle. Auntie one day might not wash it well. Or the following day, one other auntie come, you tell them to go and wash the bottle. Another auntie come, no. So limit multiple caregivers, such that the reason why this is important, for instance, when the child comes down with diarrhea, you just know, okay, I'm the mother, I'm the one that usually wash the feeding bottle. Is there something I'm not doing well? That's if you are using feeding bottle for the child. Or I'm not sterilizing this bottle well, or what is wrong? Is there something you'll be able to trace it to yourself? Not that you're not be thinking, or is it when Auntie one day came that day, or is it when Auntie Dara came? Is it when so limit multiple caregivers when you are taking care of your babies. Good personal hygiene, rotavirus vaccination. We can see this picture, a child is being given. Let's ensure our children go for immunization. It's very important. It helps to prevent all these vaccine preventable diseases, and health education and promotion, which is what we are doing here. Doing health education and promotion. Thank you very much for listening. This is my reference, Treatment of Diarrhea by WHO Manual for Physicians and Health Workers. And thank you very much. So move to the question and answer section. Kemi, I'm done. Thank you.
Yeah, thank you so much for that. That was really, really amazing. So let's take questions. Let's say questions. I'm sure some of us have questions. If you've ever had any baby with diarrhea, what are the major challenges that you had, just trying to treat it? So let's ask, and it may not even be related to diarrhea. This is a pediatrician. All those questions that you always want to ask, please ask them now so that, she can answer. Just type it in the chat box. If you can type it in the chat box if you have any questions. If you want to unmute yourself and just, go ahead, please do. Okay, Moturayo, please, your question.
Thank you so much, Dr. Kemi. Thank you, Dr. Temitope, for that really great information. Thank you so much. Really appreciate it. God bless you. My question is, um, you know how they will say, and here too, because here in North America, where bacterial infection is not very, very common, when kids have diarrhea, they usually will just ask you to manage it at home. And again, it's so scary for me. Like I can't imagine my child, and I'm just looking and you're saying, and even me as an adult, I hate that ORS. I can never swallow it for anything. And I know my kids don't even tolerate it at all. So I don't know. And here, maybe I think even in Nigeria, because I mean I've lived in both places, and I remember my first son also having diarrhea in Nigeria, and we'll take him to the hospital, and immediately, they start the supportive treatment. But here, they will send you back home and tell you to go and manage it at home. How, in that case, do we manage it? Especially when the kids are not taking these ORS, as in they cannot, because this last one I had, and that was why I had to call the the pharmacist, and then he had to give some medication, to help. I know that usually they don't encourage medication because they want the child to pass out whatever is irritating them, but it can be so scary. So how do we calm ourselves as moms and not run to medication?
Yes. Yes, that's one of the drawbacks of the ORS. Is not palatable. It's not palatable. But at the same time, it is the treatment to prevent dehydration. The how will I say it now? The benefit is much more better than that side effect or that unpalatable taste that it has. So what we can do, I usually cajole our children now. and cajole them and know and appeal to them to take what you might now do now, you might give them little quantity. So you don't expect the child to drink it as if the child is drinking Lucozade boost or any sweetening products, sweetening drink. So you may have to, that's one of the sacrifices one has to make. You may have to give them little by little. The frequency will be little by little. Maybe you can give them half cup, encourage, oh, take it, that's my boy, that's my girl, this and that. Because that is the treatment. So you just have to encourage them. I think there are some flavors that are sweet, but I haven't come across them as in my training. The ones I have seen are the ones that are not too palatable in to taste. So the only thing you can do is just to encourage them. Like when in cases where mothers come to the hospital and they say, oh, madam, doing ORS. Oh, the child is not taking the ORS for age. And I know when you see the child is jumping up and down. No, child is not dehydrated, is active, child is crying and all those things. So, madam, please, we have to encourage this child to drink this ORS. Or do you want us to give the child do you want us to pass like a mini thread to pass NG2? Well, it's all NG2. Oh, we'll pass a tube from the nose that will go down to the stomach. When they hear that, it's like that their motherly instinct just rise up and say, okay, doctor, don't worry, I'm going to cajole this child and encourage this child to drink the ORS because they don't want us to pass tube for the child. So we just have to encourage them. We have to, oh, my baby, I love you, and we might have to give them little by little, so that little by little quantity, that for desired quantity that they are supposed to take for their age. So that's the only thing we can do. There's nothing we can do, to be sincere. There's no other alternative to ORS. ORS is the treatment of diarrhea to prevent dehydration in children. Okay. Also, have I answered your question? I know I didn't answer it. I know that's not the answer, but that's the answer I have or we have for that question. Okay.
We have more questions. Thank you so much for that brilliant answer. And I think that's also one of the major challenge,
Yes.
when my kids were younger, like getting them, because even me as a grown-up, taking that thing is, oh my goodness, it's not funny,
Palatable.
so yeah. So it's a very valid question. Thank you so much. I guess you just keep trying and making sure that, they take it. Do we have any more questions?
Can I ask? I have a question. Sorry, I don't know how to raise my hand on this app. Thank you so much, Dr. Temitope, for your presentation. I just have a question, or more like a comment to what Monturayo had asked. So I was wondering, what if your child likes milk, for example? It's not a sweet drink, but is it okay to dilute that, like make it more, maybe a bit more watery? That way they're getting more water, but they're also taking something they can tolerate. Because I know here in North America, because Mutuari was asking, there is this nutritional supplement they call Pediasure. So it's kind of like if your child is not eating, you can actually replace that with their food. It has calories, it has like a lot of vitamins and like nutrients. So can that be like, it's not really ORS, but at least it's liquid and it's actually like food, but it's in liquid form. Would that be okay?
Yes, that would be okay. But we say in diarrhea, we're trying to there's lots of fluid and also electrolytes. Now that's the milky form, diluting the milk and with the other supplement is going to help to replace the fluid. It's also going to help to prevent malnutrition. But the aspect of the electrolytes, it is not addressing. And now one of the things they can have in diarrhea is when they lose potassium. When they lose potassium, well, in diarrhea, we call it they can have low blood potassium in the body. We call it hypokalemia, and hypokalemia can cause what we call paralytic ileus. What that means is that the bowels, the intestine in the system will just be paralyzed. Let me use that word. And so the child will come with stomach that is distended. Cannot tolerate even fluid, cannot tolerate even feed anymore because the stomach is distended, which is what we're trying to prevent in diarrhea. So that's regimen is addressing the fluid, also addressing nutritional support, but it's not addressing the electrolytes. Exactly. Yes. That's just it's not addressing the electrolytes, which ORS does. ORS addresses the electrolytes for children. Yes.
Thank you so much. Thank you so much. I think that really explains why, because you see a lot of people saying, oh yes, give Ribena, at least the grandparents and say, but like let something just be entering the child's tummy, right? But like we said, you want to address the electrolytes. So thank you for that. Questions?
There are no questions in the chat box. The chat box is clear.
All right, thank you so much, Dr. Okoro. Thank you, everybody, for participating. We thank you so much, Dr. Okoro, for that wonderful presentation. It was very enriching, enlightening, and really informative. And I'm sure that everyone that has attended this would, make use of the valuable tips that you've given us today. So thank you so much. Everyone, please, let's say thank you to Dr. Okoro.
Thank you. Thank you for coming.
Thank you so much,
Thank
Dr.
you.
Okoro.
Very much.
God
Thank
bless you. God replenish your knowledge. Well,
Thank
Dr.
you.
Thank you
Thank
so
you,
much.
Dr. Okoro.
Amen.
Thank
Thank you.
All right. See you guys. See you in our next health talk. We'll have another one next month, and we're looking forward to seeing everybody. Thank you so very much. God bless you, everyone.
Thank you so
Thank
much.
you, Dr. Kemi. Thank you,
Well
lovely
done to
team.
the Rafa
Thank you,
girls.
Rafa girls. God
Thank
bless
you.
you.
Thank you, Rafa girls. Yes, thank you.